Today, we are fortunate to have a presenting sponsor, the Oklahoma City County Health Foundation, together with the Inasmuch Foundation, and I'd like you all to help me thank them. We're also supported by the Oklahoma City Community Foundation, by the Museum of Art in this lovely facility today. We also thank Kirk Angel, Inc. for providing the water today, and our friends at Not Your Average Joe as well. Also, thanks to the Oklahoma City Parks and Rec Department. They're helping us with our video services today, among other things, and you'll meet one of their individuals shortly. And I'm just going to go ahead and say it's Melinda, so we look forward to talking with you. Elected officials, I'm looking. I know we have a member of the Parks Commission here, but we have so many community leaders. I think I'll just let you meet them all in the lobby, and let me get right to the point of introducing Dr. Leslie Hudson. She is our former board chair, and we're thrilled, and she's going to be here to introduce our speaker.
Thank you, Marcia. It's my great pleasure to be here today to introduce our morning speaker, Dr. Robert Zarr. His work came to our attention on the Parks and Trails Foundation about 3 or 4 years ago, and we've been relentlessly hounding him to get a spot on his schedule to come to Oklahoma City for our spring lecture series. Dr. Zarr is a physician specializing in pediatrics and public health. He practices in the Unity Healthcare and Children's Hospital System in Eastern Ontario, Canada. Before relocating to Canada, Dr. Zarr was based in metropolitan Washington, D.C. for more than 20 years, where he provided medical care to underserved minority populations in the area, pediatric populations. Dr. Zarr is a native of Austin, Texas. He earned his medical degree at Baylor University, completing his residency in pediatrics at Texas Children's Hospital there at Baylor. During medical school, he took a hiatus and earned a Master's of Public Health degree at the UT Health Sciences Center in Houston. He's also a certified nature therapy guide. Dr. Zarr's work is an innovative combination of clinical medicine through the lens of public and environmental health, recognition of the value of being in nature to physical and mental health, public space activation, common sense, and technology tailored to the patient. He was the founder and first medical director of Park RX America, of which he'll speak about this morning, and he served as an advisor to the National Park Service. Please join me in welcoming Dr. Robert Zarr.
Thank you for a lovely introduction. Fabulous. Well, thanks for having me, and I'm so glad that you hounded me. So it's great to be here. I know it's been a long time in the works, and I just shout out to Marcia, really, for all of your persistence and dedication and commitment to making sure that this day goes smoothly, and for taking me around all day yesterday as well. So thank you so much. So I'm going to do a little bit of walking around because I don't have a screen up here, so I am mic'd, as you can tell. So I'm going to talk a little bit about nature and health more broadly, and then I'm going to dive into some little more details as to what this nature prescription is, and then really kind of finish up with maybe some thoughts for what might even happen here in Oklahoma City as it relates to this talk, fingers crossed. First, I just want to quick thank you to REI Co-op Action Fund. They've given us a generous gift, which is very helpful to our very small nonprofit organization for us to keep working. I have no disclosures to make. So this is the United Nations Sustainable Development Goal slide that I have. And for those of you who are not familiar with this, there's a list of goals, and one of them is Goal 11. And I love that this exists and that there is mention and sort of, a shout out to the importance of green space, to the importance of public green space, as it plays a really significant role in what I refer to as the social determinants of health. So we often don't think about parks that way, we don't think about green space that way, but clearly it should be thought that way, and it is an essential part of our health and our happiness, and it's been recognized to be so, at least by the United Nations. This is the nature pyramid. My work tends to sort of focus down here on the bottom of it, and that means that I'm really interested in those frequent daily exposure to nature, right? What is it we do every day? Now, it's not that I'm not interested in up here, right? I've been to the Grand Tetons, I've been to Big Ben, and I think they're great, amazing places. But the reality is, most Americans will probably, not have the same opportunities that I've had to go visit, and they may happen once a year. One thing that I will contest a little bit is this, at the bottom here, it says intensity of immersion, and now that I'm a certified nature and forest therapy guide, I have definitely, drunk the Kool-Aid and have completely convinced that you can have really intense experiences through your senses by being outdoors. I think Marcia gave a great example of that this morning. Just even right outside the museum, there's the sound of water, there's the leaves, there's the sun, and if we start to be more mindful of that, I think we can have just as intense experiences in nearby nature. This is unfortunately what most of us do during the day, or many of us. We're trying hard not to, but we're very sedentary, don't have a lot of time to eat, so we're very rushed with our food. Sometimes we have to eat fast food. We have a lot of stress, and we take all of that to our doctor, and we ask them for a pill, or we ask them for some medical test, use of medical technology. This is the reality of our world as physicians, and then I think our world as patients as well. So having said that, I just threw up some of these. This is sort of what we see through our physician scientist lenses, right, is this epidemic of hypertension, of diabetes, of obesity, and then a large category of serious mental health illness. Largely, we're talking about depression and anxiety, but you can certainly add to that. This has been exacerbated to some degree because of the pandemic, and I don't think we've quite come out of it yet. So there are some residual things that we are still seeing. We know, for example, that children are still very much sedentary and very minimal physical activity than levels before. Now, all of those relate to the top 10 causes of death. I'm sorry, I'm going to get really fast through all this negative downer stuff. We're going to move on in just a second, but I really do want to set the stage for what we are experiencing, and sometimes it's not obvious in our daily lives. I think it's probably more obvious for a healthcare professional when we're seeing this day in, day out. Now, lest we think that physicians are just in great health and always chipper and have this overflowing health and enthusiasm, we'd like you to think that. But the truth is that many of us are suffering from a lot of the same problems that our patients suffer from. One of the things that has been coming up very much in the last few years, at least internally within medicine, I think, is some of this physician burnout. I don't know if, as a patient, you necessarily sense that or see that, but it is definitely something that we are struggling with, and I think the pandemic, once again, has put an acute stressor on what we would call as just chronic stress. We also know that depression is quite common among physicians, and you can see the difference between male and female physicians. So even higher among female, and so high among female physicians that's higher than the average rate of depression in the general population. And lastly, I think, and very much depressing to me, is that I lose about one colleague a day in the United States. One colleague a day to suicide. So it's a very serious problem that I think we need to at least be aware of, and I'm working on personally to try to address through my work. Okay, happy. We're going to go to happy, a little more happy now. So what do we do about these things, right? I attended a talk by Rich Louv in 2010, I think it was. So it's going back now. It was about 14 years ago at the American Academy of Pediatrics in San Francisco. And he was talking about nature deficit disorder. I had no idea what that was. I read his book, and then it was one book then. Now he's written, I think, at least 3. And I was overwhelmed with the amount of science back then, this is 14 years ago, that was showing us the benefits of being outdoors. And truthfully, there aren't that many aha moments in our lives, but that was one of them. When I heard him speak, when I read what I needed to read, when I learned the science behind this, I mean, literally, I said, I got to get back to DC and do something about this. And that's really where my journey started, 2010. And since then, there have been somewhere in the order of probably 400, 500 published studies on this. At the time, it was probably more like 250, 300. So there's a lot of interest, even in the scientific community, to understand why these things are, why it's so important for us to be outdoors in nature. So I'm not going to go in too much detail, because I know I have limited time, but I just wanted to point out that yes, compared to the previous slide, I showed you like hypertension and obesity and diabetes and mental health. Well, all of those things are actually impacted positively by being outdoors. Hypertension is a silent killer, right? So most of us, if we have hypertension, don't know we have it, oftentimes until the day we have a heart attack or stroke, right? So it's one of these real difficult things that can keep hidden for a long time. So it's important for us to realize that as well, and to realize that sometimes as little as 10 minutes, right? 10 minutes, or these frequent 10-minute breaks, like Marcia did before she came in, right? Those are immensely helpful, and something that we don't usually do in our daily, many of us don't do in our daily routine. So diabetes is related to many of these other risk factors in chronic disease. So we have a lot of sort of covariates here, or comorbidities. And we know that if we're going to be outdoors, we're more likely to move. We know that people who live near parks, who live near green areas, tend to have lower risk for developing diabetes, lower A1C, et cetera, et cetera. I mentioned depression earlier on. And depression, there's it's a spectrum, right? I mean, there's depressed symptoms, and there's clinical depression, and within that, there's many other diagnoses. And I'm sure there's a psychiatrist in the audience who can better describe the ins and outs of depression. But we do know that even the simple act of walking outdoors has a measurable impact on our mood. This particular study, it ties into nature and forest therapy. So, and I just want to point out, nature in this sentence is really the therapist. So I'm a guide. So as a guide, I actually don't do the therapy. I'm not the therapist. So I had to really, when I became a certified guide, understand the difference, is that I'm going to take off my doctor hat, and I'm literally going to be a guide and let nature do its work and be the therapist. There's been a number of studies, initially starting in Japan. This is an ancient practice Japanese practice of immersing your senses in a nature-rich area. Initially, the studies were done in these forested areas in Japan. It's now spread all over the world. I would say Korea is actually sort of leading, one of the places where it's leading the science and the implementation on a national level with this. But one of the things they looked at was salivary cholesterol, in addition to these natural killer cells, which are, an more ancient part of our immune system, we think, and protective in terms of preventing cancer. And what they found was that when you spend time in these forested areas and you breathe in these phytoncides from the trees that help the trees, but apparently also help us, you have this lasting effect that can be up to almost a month, right? So once again, these intermittent, frequent periods of time we can spend near and around trees are very good for our health. Well, this is sort of obvious, right? I mean, physical activity, we know now after decades of science even, is good for us, right? Our kids should go out and play. Structured play, unstructured play, all the things that you can do with the immensity of programming and amenities here in Oklahoma City with your parks. We also know that being outdoors and moving outdoors adds an additional benefit than one that you might get in a gym. I love gyms. I love the one at Dr. Dosseri's clinic. But if you add that extra component of nature, you get an extra benefit of mental health. So that's something that I like to mention, because it's good to move. It's better to move outside if you can and when you can, even if it's just a little bit of time every day. This is something you saw on the earlier slide about physicians, and we don't sleep. We don't get the quality sleep and the amount of sleep that we need. And with the amount of caffeine and stress and jobs that we all take on every day, it's really important for us to move, especially outdoors, so that we can, in fact, improve our sleep. I've mentioned stress a number of times. There's been a number of studies looking at stress and measuring salivary cholesterol. Some studies actually also look at the salivary alpha amylase. These are markers for stress that you see go up when we don't take the time that we need to take to find that sort of mindful, meditative, or even just physically active time outdoors. I mentioned already a little bit about forest bathing, and here's some more of the data that has come out in some of the studies. So I mentioned already the reduction in salivary cholesterol. We see a reduction in blood pressure, reduction in heart rate, and we have this built-in system in our bodies, our parasympathetic and sympathetic nervous system, our autonomic nervous system, which we don't know a whole lot about usually, just because we go about our day. But when we're stressed, our sympathetic drive goes up. And one of the things that we have found with forest therapy or nature therapy is that it really brings up your parasympathetic, which is more of that relaxation feeling to it. Well, there's a word, so I said I would kind of stop on the negative stuff, but I just wanted to point out the word rumination. And I bring this up in particular because for our brain health, right? I mean, so if we're constantly on the news cycle, right, 24/7, if we've got a lot of stress in our daily jobs, et cetera, if we're listening to the news about climate change, if we're listening to news about the crime in the city, there's a lot of this negative thoughts that start going through our head, and it becomes the cyclic thing, and we think is a risk factor for developing full-on depression. And we also know that through a number of different studies that once again, I sound like a broken record here, but spending time outdoors has been shown to actually reduce this rumination. Okay, so I have covered the science in about 5 minutes. I highly recommend that if you're interested, there's a lot more out there to be learned. Please come and visit our website even, natureprescribed.org. We have a lot more on there. We're not the only repository of information, so there's a lot out there at the National Libraries of Medicine, et cetera, et cetera. So on to the nature prescription. I put up here, on your left, the medication prescription, which is over here, if you can see the laser. And on the right is the nature prescription. Now, on the surface, it looks very similar, right? And I like that about it because you kind of think, okay, there's a name of the medication. Well, you have to have the name of a park or a name of a place that you're going to be outdoors, right? You have how you're going to take the medication, we call the SIG. Well, what are you going to do outdoors? That's sort of the activity, right? So, what do you plan on doing? What do you wish to do outdoors? So there's these different, kind of areas where I thought, well, it's similar enough, and I love the idea. I did not come up with this, by the way, so I think credit really goes more to the National Park Service, and then even beyond that to Australia's National Park Service. But I really love the idea of it being called a prescription for a number of reasons. One, it just gives validity to it. It has a little depth to it. People know what it is. There's no patient in the world, no person in the world, and no doctor, no physician, no physical therapist who doesn't know what an RX is. So it's easily identifiable. Now, having said that, I do think that there's a big, big difference between writing a prescription for amoxicillin or penicillin or an antihypertensive medication and doing a nature prescription, because a nature prescription is co-produced, right? It has to have a conversation between your patient and you as the doctor, or you and your psychiatrist, or you and your therapist. It really has to be co-produced. And I like that because what it does is it lends opportunities for a short, very brief, what we call physician intervention, or let's just call it a brief health professional intervention, and it's positive. Right? So we kind of turn everything upside down on its head with this nature prescription. And we say, okay, it's not our job to tell people what to do. it might be our job to ask the right questions. And you'll see that what that looks like in just a second, what I'm getting at here. But these are the components of it, so at least you could see that now. And onto our website, I just took a screenshot yesterday. We have 2 portal entries, one for providers, one for patients, just to give you a glimpse of what you see, what we see as doctors when we go on and prescribe. You get this, this pop-up window that says, did you check the last prescription you wrote, right? And you want to know how many times your patient actually logged their visit from between one visit and the next. This is not a one-time deal, right? It's not like you come once in your lifetime to the doctor and they make one nature prescription. This is a concept of doing it every time you go. Every time you go, you have a brief conversation about where and how you spend time outdoors and what your goals are. So it's a goal-setting activity that happens every 1, 2, 3, 6 months, however often you need to go and see your health professionals. So once that's done, it gives me, as the doctor, a glimpse into maybe what happened in that last month or 2 or 3. If I see 0 down here, well, I'm worried. Either their phone went dead and they didn't use it, or they didn't actually fill them. And my experience has been that oftentimes these are underrepresenting what actually happens, meaning that people often do fill their prescriptions, but they forget to go here and actually log their visits, which is all done on their cell phone these days. This is what the prescription looks like to both the patient and to the doctor who's prescribing, or to the health professional who's prescribing. And we very carefully and intentionally put the questions in there, because I've had a lot of doctors over many years now say, what do I ask? I don't know how to do this. I feel awkward in doing this. I was like, don't worry. It's right there for you. It's right on the screen. So just be natural about it, the way you do things. You're already good at what you do. You know how to do motivational interviewing. Ask a few questions, really what it is. And while you're asking questions of your patient and co-producing a prescription, type it in. Just type it in. It takes really about 1 or 2 minutes. And I know we don't have a lot of time. We have about 15 minutes max usually per patient per visit. Maybe if you're lucky you get 30, but most of us are very limited in our time. And then you ask questions about activity. So going back to place, we want to know, where do you feel safe and comfortable? Activity, what do you like to do? What do you wish to do? What do you wish to do more outdoors? The frequency. And asking questions this way about frequency and duration, it's really asking your patient to think about their schedule, think about where they can insert it. So rather than my saying, Marcia, I really need you to ride your bicycle twice a day for 5 days. I don't even know if Marcia has a bicycle, right? So the point here is that if you ask questions and you're quick about it and you're efficient about it and you have a tool to do it that takes very little of your time, it happens, right? It's a commitment, it's a contract of sorts between you and your patient, and you can hold your patient accountable for what happens between one visit and the next. We have it in English and Spanish, and it gets submitted to them. And while you're writing your prescription, now this just happened thanks to Melinda and her team, so we now have at least a starter for getting all of the parks in Oklahoma City in our platform. So if there's a physician or a physical therapist or a therapist in the audience today and you want to do this, you can actually do it right here, right now. But having said that, you don't always have to have a park. Someone may say to you, if you ask that question, where do you feel safe and comfortable outdoors? They might say, my backyard. That's wonderful. How much time do you spend usually in your backyard? None. Which is often the answer, right? People are busy. They don't even go outdoors. They spend 90% of their time indoors, sleeping and awake. So it doesn't have to be a park, but we love the fact that you have such good programming, such good amenities. You have like a renaissance of parks happening in this city. Why not use them? It's a resource, and it's part of that SDH. It's part of that social determinant of health, right? As the UN has told us time and time again. So that's the prescription. It's really quite simple. I know it sounds like a lot, perhaps, because you're hearing maybe for the first time, but in reality, it's very quick. And what I teach doctors to do is to do this seamlessly throughout the visit, right? So it's not something that should take any time, and I like to say it's not in addition to the work you do. It is part and parcel of the work that you do, which is counsel your patients, listen to your patients, right? So this is sort of the new age of medicine, where we're not saying, you need to do this, this, and this, I'll see you in 3 months. It's more of a conversation now. We want to co-produce this prescription together. The second half is the reminders, just as important. So the reminders is what happens between one visit and the next visit. It's that interval of time. So I'm going to see a kid who has, suffering from diabetes, obesity, and asthma at least once every 3 months, right? I need to do that. So in that 3-month interval, what happens, right? And so what happens for us with this prescription is unique in the sense that I am getting consent to send a text message or an email or whatever they want, however they want it. Those are the two most common ways, to them to remind them to fill the prescription and to log their visit. Now, I've been asked many questions over the last 24 hours. Can you add questions to it? Can you do this? Can you do that? All of the above. Absolutely. So I'm involved in a lot of research. And if for those of you who are interested in evaluating this and having data about this, for example, in the research that I do, we've tied a couple of questions to every time the patient needs to log their visit, one about mood and one about nature connectivity. So you can gather information that can help us understand how does it feel to be outdoors at that time, real time for them. And then we set the duration based on that interval of time. So if I'm going to see somebody in 3 months, I'll do 3 months. If I'm going to see them in 1 month, I do 1 month. I encourage all our providers to let the default, let it be to every day. And even if Marcia, I'm sorry to keep picking on you, Marcia, but even if Marcia says, I only have time on Monday, Wednesday, and Friday to walk with John, I'm like, okay, that's great. But let's do it every day, because maybe next week it'll be Tuesday and Thursday. And I want you to get that reminder every day. And it's the recommendation, right? I mean, who here would be willing to raise their hand and say that they don't need to be outdoors every day? I mean, who doesn't want to be outdoors? It's fun, right? I mean, adults need to have fun just like kids. We need to do this, and we need reminders. Now, it's all about making it easy for the doctors, right, and for the patients. So we put this big blue button that says copy. They tap on that button, they paste it in their EHR, and they're done, literally. I can't exaggerate this enough. It's very easy to do. And there's a little bit of a learning curve. I think the more the learning curve is in like asking questions rather than telling our patients what to do. But once you get over that, it's really amazingly easy. Now, just a little bit about our website as well. So I mentioned earlier we have the patient portal, we have the physician portal, and I mentioned this earlier as well about writing your own prescription. And I want to show you that it looks exactly like the one you saw before. So complete transparency. I want the world to know what your doctors also know or should know about these nature prescriptions and how it's done. And so much so, we're really encouraging the public to write their own nature prescriptions. Take it to their doctors. Take it to their physical therapist. Take it to their occupational therapist. Say, well, have you heard about nature prescriptions? And would you help me a little bit? And I want that to happen because I don't want the public to write their own prescriptions in a vacuum. I want them to write their prescriptions, take it to their doctor, have that brief conversation, just to make sure that the patient is maximizing therapeutic potential, is being safe about it. I don't want somebody who's at the verge of having a heart attack or a stroke have it while running a marathon because they wrote their own prescription, right? So it's really important to have that conversation with your doctor or your health professional to make sure that what you're planning on doing makes some sense, right? All right, a little about research, and then I think we're gonna tidy this up here. So I'm involved in a NIH-funded randomized controlled trial right now. I'm a principal investigator, and it's been going on for 4.5 years, about 5 months left. And what we're doing is, this is the largest that I know of that's been done yet. It's a randomized controlled trial, and we've enrolled kids between the ages of 6 and 16. And we have a group of kids, it's about 500 in all, but 250 of those kids are getting care as usual. Whatever they normally get, they get. And we have another group of kids, the other 250, who are getting health care as usual, plus a nature prescription. And as frequent as visits that we think is necessary. We're really encouraging at least once every 3 months. But if someone I mentioned has multiple comorbid conditions, they might have to see them every month. So it really depends on the conditions of the patient. But they're enrolled for about 2 years. And the primary outcome of this study is physical activity, moderate to vigorous physical activity, which I have up here. So we've attached these accelerometers. They're actually on their waists. And they wear them for a week at a time, 5 times during the 2-year period. We're looking at a lot of secondary outcomes as well. And you can see them up there. So we've asked a lot of questions on surveys to them. That's happening 5 times throughout the 2-year period for the study as well. I don't have anything final to share with you on this, but it does appear that the preliminary data seems to suggest that at about that 6-month mark, there is a difference between the two groups. Now, mind you, we started this study in March of 2020. We had been preparing, planning for this study to happen in 2019. No one knew the pandemic was going to happen. We had a brief conversation whether we should do this or not. And truthfully, like one of my motivations for just doing it was that I already had a hunch that there was going to be so much mental health burden and physical and mental health worsening outcomes in our kids if we don't do this. So at least I thought this is an opportunity to help, half of those study participants at the very least. I'm so glad we did it. We had a lot of hurdles, as you can imagine. Everything went virtual all of a sudden. So it changed everything for the research as it changed everything for our lives. I just wanted to mention a couple of other ideas. This is here, International Rescue Committee, IRC, and Child Trends and PRA had partnered last year to submit another proposal to the NIH to do what we call a feasibility clinical trial. And I'm only pointing this out because we didn't get funded, and we're looking for other funders. But I'm pointing it out because this down here, we intend to use mentors, volunteers in the community to issue prescriptions in the work that they do with refugee adolescents. So this was the idea. Is it feasible? Can we do this? How is it? Is it going to be accepted? Is it going to be adopted? Is it going to be embraced? And can it be done? This is the big question mark by non-healthcare professionals. I would say yes, it probably can. And with a little bit more training, a little bit of education that is not necessarily necessary for healthcare professionals. But I wanted to point out that if this is an idea somebody here in the room has, it's something that we are already thinking about and trying to do ourselves. And then down here, this is the Mental Insight Foundation. El Centro de Corazon is a community health center, federally qualified health center in Houston, Texas, East End District. And I'm pointing this out because you remember that slide about physician health, right? The suicide, the depression, the sleep issues, alcoholism or alcohol problem drinking. I have come to this conclusion, this hypothesis, not a conclusion, a hypothesis, that one of the difficulties with getting physicians to write prescriptions might in fact be their own mental health, right? Because of the burnout and the stress and things like that. So I thought rather than using that small amount of funding from MIF to go towards clients and patients, what about working with the doctors directly? So I had an opportunity to work with 20 physicians at this health center, and it was varied, family practice, pediatrics, mental health, dentists, OBGYN, et cetera. And what we did was we asked them, what would you like, to beautify your clinic? It's very, very rare these days for them to come to your clinic, come to your office and say, what would you like to make your day better? It doesn't happen very often, unfortunately. At least in my role, it doesn't. So it was. They were a little surprised, and I said, "Tell me if could it be that you would like anything natural, some kind of nature in your office?" And they came up with these ideas, right? They wanted indoor plants, they wanted nature photographs, they wanted these digitized frames where it has nature photographs scrolling through. And I added a nature and therapy walk, of course, because I'm a guide. So we gave them all these things, and we wanted to monitor any changes in their attitudes and behaviors, including their prescribing behavior over the course of a year. Very small group, 20, so I don't have a big N. I don't have enough power in the study to say, wow, it was incredible. But what I can tell you is that the individual stories of these doctors blew me away. When I went for the final site visit, and I went there, and they're all dressed in their PPE and their gowns and everything, seeing patients, and I knew they were busy, and I said, I know you don't have time to meet, but I just wanted to say hello. And they said back to me, Dr. Zarr, come back, and you got to see. And I was like, see what? See my plant. I was blown away. Honestly, it sounds maybe silly to you, but adding just a small amount of beauty in people's lives, and these are providers. And remember, every provider has a panel of 1,000 or 2,000 patients. So having a happier, healthier doctor, should we think, kind of run into their work, spill over into their work, and make for better care? Who wants a grouchy, cranky, angry, not well-slept, alcoholic doctor? I'm not proposing that a plant will cure alcoholism, but But what I am saying is that there are some differences that we've seen, and so much so they're asking us to come back this year. So we're hoping now, rather than just have the nature indoors for them, is to get them outdoors. So we have put a proposal in to have the doctors and all of the staff now, so 90 people, plant trees, tend the trees, and give them a quarterly walk. Now I know you're thinking, doctors don't have time to go for a walk. When are they going to do this, right? Well, here's a little secret that I can tell you. During their staff meetings, that's when you do them, right? So we have staff meetings usually once a month, and if you schedule them in once every 3 months or 4 months, it's an opportunity for them to get outdoors, to be with each other, and to do something that is bonding and in nature and outdoors. So there's a lot of good data to suggest that's going to help them. So we're, fingers crossed we get that. I just mentioned this here as well. Here is our protocol paper. If anybody wants to get deep into the details of the study, I put it up there for you as well. And just to let you know, we've been doing PRA, Park Rex America, has been at this in our more or less current format since maybe January of 2019. I should have changed that, Melinda, to 12,174 parks. We don't have all of the parks in the U.S. in yet. We're working on it. We're actually, with that REI Action Fund funding, we are working on seeing if we can get at least the vast majority, at least of urban parks in our platform. So that's one of our big goals for 2024. We have now over 1,700 healthcare professionals, mostly doctors, who've joined our platform. Collectively, we have issued over 6,800 prescriptions. And maybe just to point out to you, can you imagine that just little tiny effort of ours? It's 3 of us. It's me, Matthew, and Stacy. Stacy's a pediatrician as well. Have been able to get these 18,000 visits to parks. And I'm telling you, I can almost guarantee you this is an underestimate, because not everybody clicks every time they go and do it, right? They don't always log their visits. This is probably a gross underestimation of our true impact. So it's just good to see, we can capture the data easily, we can share that data with you, and you can know what we're doing. This is a quick slide in terms of physician growth or provider growth in terms of joining our platform. And this, I think, is one of the last things, which is that, it's nice to say, I have 1,700, right? Doctors who've joined our platform. But who are these people, right? So I'd like to know, is there something about these people, these doctors, I call them people, these doctors who've joined our platform that maybe can bring some light to their propensity to prescribe, for example. So we sent out a survey to all about 1,500 of those 1,700. I had to exclude those who were in another study. And 135 actually completed a survey. Can you imagine that? Busy doctors took the time to complete a 5-minute survey. We did bribe them with a little gift card, but doctors love gift cards. They love gifts. And it turns out that that there is a majority of these providers are white, they're female, they're middle-aged, and they work in the outpatient world. This is what I found out. Interesting, right? So it gives me some insight that we're not quite as diverse, at least in that sense, as we'd like to be. But it's areas where I can start to say, okay, maybe it's time for us to more target our outreach in that way. We know that from specialty-wise, and this was a little bit of a shocker, but not so much for me, is that of the kind of groups of specialty that we could say, okay, who are these people in terms of specialty? Mental and behavioral health folks was the largest group. Makes sense, right? I mean, we know that it's really good for us to be outdoors, especially for our mental health, right? When the kid's indoor all day and the kid's on the iPad or on the tablet all day, what do we tell them finally? Go outside, right? We know, just know they need to go play outdoors. So it's a big part of what we see in terms of our providers. And then family medicine, pediatrics, internal medicine were the subsequent groups, slightly smaller in size. We know from what they answered on the survey that burnout and exhaustion is pretty high, amazingly high, higher than I had expected, even in the literature that I'd already. And there's not a lot in the literature about physician health, by the way, probably because the physicians are doing the doing the research. We also know that a lot of their time is on screens. Obviously, all of our times are on screen, so that wasn't a huge thing. And we also, saw, and this was very encouraging, that a huge number of the people who completed this survey have a belief that nature prescriptions improve physical and mental health. Now, don't be confused with this to think that that means they actually prescribe, but they at least have a belief in it. And that's important for us to know, because it's one thing to know something, it's one thing to actually put that something you know into action and implement it. And lastly, we used this connectivity to nature score, CNS score, which those of us in medicine, it's not central nervous system, it is connectivity to nature score, which really is I think, a brilliant set of 14 questions. It gets at your emotional connection to nature. And what we found was that the respondents, the physicians who responded to this, if they scored high on that, there did seem to be a positive association with their likelihood to prescribe. And there was also a positive association for those physicians who filled out the survey in terms of the time they spent, the frequency of time outdoors also was positively associated with their propensity to prescribe. So this is really important for me to know, and I think for all of us to know, that if we have a group of healthier physicians, healthcare professionals who spend time outdoors, who have a connection to nature, or perhaps, going a step back, have opportunities to spend more time in nature. So focusing on the healthcare professionals, for example, in Oklahoma City, might that mean they're more likely to extend that to their patients and prescribe to them? And I think the answer is, let's find out. Let's find out. Okay, so this is my slide to say we're finished with this set. I know a little bit of what's happening in the neighborhood, but I'll leave that to the panel discussion to get a little deeper to that. So thank you so much.
Thank you so very much. If our panelists would please come up and join me on the stage, we'll have our great discussions here moving forward.
She's got one, and I have one already.
So hello, thank you for coming out this morning. I really appreciate you being here. As a huge advocate of parks and recreation, of course. I'm the director for OKC Parks. I've been the director for almost 3 years now. Lived in Oklahoma City about 10 years now. So it's really a great opportunity to be able to talk with all these wonderful professionals in their field who are really doing those cutting edge and leading all of us in our communities to have a better, healthier life. So I have various questions. Wow, that was loud. Excuse me. I have various questions for all of you, and if I'll probably just take each question and ask each of you individually if you want to just give a response. But first, if we want to we know who Dr. Zarr is, but if you each want to just introduce yourselves briefly to the group and kind of the organization that you work with, that'd be wonderful, please. Thank you.
I'll start. I'm David Kendrick. I'm an internal medicine and pediatrics physician and a clinical informaticist, and I chair the Department of Medical Informatics at the University of Oklahoma and lead a nonprofit effort called My Health Access Network, which is our health information exchange here in Oklahoma.
I'm Dr. Paul Dasri. I am a pediatric endocrinologist, and I work at the Oklahoma City Indian Clinic. I'm the director of pediatrics over there and also run our weight management clinic over there. We are a nonprofit organization, very proud to serve, Native American community, and have several resources. Was with Dr. Zarr yesterday showing off of what we have in our clinic, like we have our own gym and exercise and nutrition program. So I'm very fortunate to be a part of an extension of what we do at our clinic.
Good morning. I'm Patrick McGough, CEO of the health department here in Oklahoma City. A lot of folks just call me Dr. Mack because I can't pronounce my last name. But I want to say, as we kick this off this morning, I saw a lot of our community leaders here, and I really just want to say thank you for your interest in this topic and for being willing to take out time out of a very, very busy day to do this so early in the morning. It's greatly appreciated. It's an honor for me to be here. This is something that I think is just ripe with public health issues all in and around it, and the synergy that we can put together on this is going to be quite amazing. So I'm looking forward to this conversation.
Thank you very much, all of you. So we'll kick it off, actually, with Dr. Mack, with you. A question that, and if everyone feel free to have a conversation about this. This doesn't have to be a very formal interaction. But so, Dr. Mack, why are parks, trails, and green spaces an important part of a community from a public health perspective?
Well, that's a great question, and I think that Dr. Zarr did a beautiful job talking about all of the information that supports the fact that being out or in or near a park a certain number of times a week can greatly impact our health. And mostly, as we're in public health, we're looking at public health, the prevention of chronic diseases that are killing us. And for decades, the top 2 or 3 things is related to cardiovascular disease in one way or another, or cancer. And that was borne out in the information that he shared this morning. And we know that if people can be active, and then there's all the information that supports the fact that people prefer to be active outside, and they prefer to be active in a park-like setting or something that has nature. And so I think there's just all kinds of potential with this related to public health. And I am excited. I'm very excited about it. And I think we can work together through things like our workforce, definitely through the physicians, the Oklahoma Medical Association, and the Hospital Association. There's ways that we can get our community partners and leaders in the medical field to participate in writing these prescriptions. And I think that's a phenomenal idea, and looking forward to that. But I think our city has done so much in the way of maps, in the way of what we do through our TIF committees and our city council, that really we're poised quite beautifully for a takeoff on this. Our local foundations, and I want to do a shout out to our board members that are here from the Oklahoma City County Health Department Foundation, and Inasmuch as well, because they both had a lot to do with us being able to do this today. And we've got leaders from that. I know Dr. Hudson's here at the front, and I see Dr. Salmeron here as well, both board members. And I believe Sarah Roberts, who is also a board member, is here somewhere, but I haven't seen her personally yet this morning. But we have some really great already synergy in place and dynamism, which is going to really impact our ability to do this. So I'm just all the way around excited about this.
That's great. I'm glad you're so excited. We're all very excited about it too. So I think, Dr. Dossary, unfortunately, Oklahoma tends to have some of the worst health indices across our country. But other larger, healthier cities tend to have very active, more active communities, less sedentary communities. So from your perspective as a provider, what are some of the barriers or even some different motivations for the Oklahoma City area, that community, that we could start considering more proactively?
Right. Thank you. Thank you for that question. I think I come from a practice that is busy, right? Day in and day out. Like Dr. Zarr was mentioning that in his talk, that we have 15 minutes with our patients, and that's a short time, right? But having said that, I would like to divide my answer into 2 groups. Like, there is barriers from the provider standpoint, and there are barriers from the patients, right? I can definitely speak very much on behalf of the providers that time is a big barrier, right? And making it a part of our practice is what we probably need to do, and it's not difficult. I was having this conversation with Dr. Zarr yesterday that we as pediatricians are very passionate about vaccines, right? And we don't leave a chance to talk about it whether the child has come in for a ear infection or a well-child check. We talk about vaccines. And this also needs to be a part of that as well. So getting the providers, or rather our entire staff, so 15 minutes is what the provider gets with the patient, but the patient is there for almost an hour in the clinic. So they have interactions with our front desk staff, there are interactions with our MA or our nurse, and then registration clerk. So there are different levels at which we can communicate this with our patients. And so, but having said that, we got to be motivated about it as well. So bringing in that motivation to the providers, and self-care is very important. And I'm very proud to say that I come from an organization that promotes self-care. Like our clinic, for example, provides 30 minutes of administrative time for our entire staff. This is in addition to our lunch break, where we get to go exercise in our gym and have access to our dietitians. So, and then in addition to that, we have wellness Wednesdays. Like yesterday, we had fruit in our break rooms that our administration was trying to promote health. So, if we are motivated enough to do it for ourselves, we will always talk about it. Like if there's a favorite recipe, if there's a favorite dish that you like, you will not start talking about it, right? This has to be the same. And so lack of motivation is a big thing, because I always tell my patients too is, don't add this as a thing that you will do in your day, make it a part of your day. If you keep adding to your plate, then it's going to get overwhelming. But if you make it a part of it, then it's not. And going out, I mean, kids, Dr. Zarr said, adults need to have fun. Kids love to have fun. They want to go out and do stuff all the time. So that brings me, that's just a good segue to talk about the patients, the barriers that the population that I serve. One is access to the parks, like transportation, one big thing. Second is, affording to go to a gym, like having a membership. It takes money to do that, and they don't have that. And so just having a free park that they can go to or exercise or do some sort of an activity outdoors, I think would be great. But if we can address that would be good. Like we after talking with Dr. Zarr and meeting the panelists last week, we had a conversation within our own group as to like what could it be that is preventing our patients to do that. Like, and one of our practitioners mentioned that there is parking fees for state parks, and people don't want to pay that, or finding a parking spot, as a matter of fact, and Melissa and I were talking about this earlier, that we love going to Scissortail Park because parking is easy, right? One of the biggest things that dawned upon me this morning is, how is parking at the Oklahoma Museum of Art? I need to get there a little bit earlier so that I can find a parking spot, scan my card, and do all that stuff. So that those are little things, but they all add up at the end of the day, because we have busy lives. We have households where both parents work, and they work after hours, and only one parent is available, and then it's really hard to put this or add this to your schedule. But if you make it a part of it, I think we'd be addressing the issue much better.
Thank you for that. Dr. Kendrick, I should maybe start this question over a little bit. We know the high costs of healthcare, that the cost keeps climbing, and I think some of that might have to do with just overall health of our entire human population is not as great as it used to be 20 years ago, 40 years ago, even sometimes we could say 80 years ago. There seemed to have been a tipping point at one point in time. I blame social media. Anyway, but I do think that we have a great cost to our healthcare system. So is there a way that we can look at the prescription of nature for our patients and our communities? Is there a correlation to any kind of healthcare savings or into our local economies that maybe could help offset some of those higher costs?
So that's a great question. I should have said in my intro, I did engineering before medicine, and so I find myself often thinking with my engineering brain as much or more than my medical brain. And I love taking care of my patients and having individual encounters with my patients, but inevitably I start to think about, well, how do we scale this, right? This problem this patient had, the last 5 patients had, why are we dealing with these things one at a time? Why aren't we figuring out how to scale these things? So my career has kind of become taking other people's great ideas and helping figure out how to scale them in the community. And one of the things we always say in engineering that is in a way embedded in evidence-based medicine is you can't fix what you can't measure, right? Which means we have to have really good data and systems that contain that data with continuous feedback, not just so that we individually can change our own behaviors and we can help patients change their behaviors, but also so that we can generate the evidence necessary to change science and to inform new pathways in healthcare, new payment models, and incentive programs to reward these things. So part of the journey I've been on since I returned home to Oklahoma in 2008 has been to build that infrastructure so that no patient is ever seen in a setting where their medical records are not available to them and the provider doesn't have complete information to be able to make an informed recommendation to the patient and enable that patient to make good choices with complete information. And so that has borne some fruit, and now we're at in a situation where we have one of the leading networks in the nation around health information exchange. We've won national awards in several fronts, and I'll tell you in a second about those. But they've positioned us to do work like this, to be able to scale projects like this, and I love cross-sector projects almost more than anything because that's one of what I always say is one of my secret powers by having done engineering and medicine is that I try to steal things from other disciplines and bring them into health and wellness as well. And so I think we have a really good opportunity here to take these concepts and these ideas and deploy them at scale. And by scale, I'll just give you an example. In 2018, we were awarded the status of an accountable health community here in Oklahoma with My Health as the center point and the Oklahoma City County and Tulsa City County Health Departments as partners on that. And the project was to do social needs screening for every patient who arrived for care. Well, we've already heard about the fact that we only have 15 minutes per visit, and we're just loaded up with things we need to gather from the patient. But gathering data is not the best use of the time when we have a narrow window to educate, to reinforce, to hear about concerns other than just the facts of what somebody's allergic to. And so we developed a novel method rather than having the providers need to ask these questions, which were themselves taking 12 minutes per patient. We developed a methodology to leverage the mobile phone, which is in about 92% of patients' hands and in their pockets when they're in the waiting room, to conduct their social needs screening and refer them when they had a need to housing or transportation or food services or others in real time. And we rolled that out in 2018, and that scaled tremendously. I'm happy to say we've hit now 4.5 million patients have been served with this program just here in Oklahoma. And it turned out to be even pandemic-proof because as people were on telemedicine, they still had their mobile devices, right? And so what we've established is a channel to get to and from the patient and then provide that information back to the provider so that by the time the patient's in the room with the provider, the food need or their transportation need is known. And to your point about people can't get to a park if they don't have transportation, we can really zero in on who and where and when needs those services because it's not typical in healthcare. We write prescriptions for drugs, and this is another important thing, information and park prescription, but we don't typically arrange transportation. And so by taking that burden off the provider side, we hope to streamline those processes. So I think that we can work together to try to put together a pilot program of some sort. I'd really be excited about that.
Okay, another question for Dr. Zarr. He thought you were going to get away with it. So now that we've had your wonderful lecture and your insight and your research, and we've had our panels here talking about it, so how would you recommend that we execute this idea in Oklahoma City? How do we help garner all of our medical professionals, our National Park Service, state parks, local parks, anyone who's interested? How do we really get this off high center? Because we'll talk about it all day long, and we all agree it's a wonderful idea, and it's wonderful, and it would be extremely beneficial to everyone. But doing it is always the next step. So what's our next step? How would we move on and move forward?
Yeah. Well, it's definitely a difficult question. And, I think I would start out by saying, as the foreigner here, not being from Oklahoma, that, you know, clearly there are so many amazing resources right here in this room. And I've met many of you over. I'm not sure. Is that me, you think? Or? Yeah. Over the really last, I guess many months with Marcia, probably working on maybe a year with her, and then in the last week having these conversations both on Zoom and now in person, which is so nice, by the way. It's really nice to be in an auditorium after so many years. And so I would say, like probably the most important thing is to continue this conversation, continue this passion that's in the room, and I would suggest that we keep building relationship. I think to me, I can tell you from my guide work even, right? It's about relationship with other humans. It's about relationship with the more than human world that becomes meaningful, right? So what am I to you, this guy who shows up for, an hour and then I'm gone? And I guess the question is like, how do we capture this moment and really sort of propel it forward? And, one of the questions that you had asked, I think last week, was what more can the parks do, right? And we've had some really interesting conversations about that even in the last 24 hours. And I think one thing that's fun to do, especially at this stage with such amazing individuals, is to sort of reimagine. Like, what is the world you want? How do you want to live? What do you want Oklahoma City to be like? Do you want it to be a model for the rest of the world? And I'm guessing the answer is yes, right? And from what I've seen in the last 24 hours, you've done amazing things already. I almost want to move here and work and work with Dr. Dossary. There's a lot that's happened that I think, that it has set the stage from, data and HEI and public health and innovations in clinic settings, amazing work from the parks that you've set the foundation up. I think it's sort of, for me, the way I see it as an outsider, if I may, is just to connect the dots and see where those intersections are. And then those of you who know how to gather funding and resources for this, because it's always necessary to get anything up and off the ground, and set some small, have the overall image of what you want, but set some reasonable goals, some small goals. Dr. Kendrick, you mentioned a pilot, for example. I love the idea of pilots. It doesn't require a lot of funding, not necessarily, but it does require that conversation that needs to happen to pull all those pieces together. And in a small way, in medicine, we talk about the PDSA, the Plan, Do, Study, Act. It doesn't need to be enormous, right? And you pull those people together, you do something, you look at it, you have the data, you study it, you understand, you kind of let that pilot inform the next step and the next step and the next step. So rather than feeling overwhelmed, what do I do today to fix Oklahoma City? No, what could I try? Get something off the ground, learn from it, and there's so many elements that we've talked about even in the last 24 hours that each of those elements could be expanded into a much broader conversation. For example, one thing we haven't talked about yet is, I've talked a little bit about it in my presentation, which is this mental health and physical health, the burden of that on the physicians or on the practitioners themselves, right? And something we don't usually talk about so much. But I just wanted to bring it up a little bit again, because if you think about the environment in which we physicians work, it's not the prettiest place usually, right? And it's often void of beauty, void of nature in that sense, right? I mean, beautification might be a place to start. And parks already have done that in a way, right? I mean, you look around the city and I look around and I'm like, wow, it raises my spirits when I see a beautiful park or beautiful monument, right? When I see people playing, when I visited this new rec center, and I saw people using it, I saw the yoga class, and I saw the swim class, and it sort of exudes this feeling of like, wow, there are things moving in the right direction. So I wonder, even just to throw that out there, what might a clinic look like or a hospital look like with park sort of merged with it, Could we possibly even reimagine these places that we send our patients to get care and we send our doctors to work that are void of nature. And I say that because if we're really serious about getting doctors to prescribe, however we do it, through AI or combination of data-driven versus the human contact, I think we need to be pretty serious about our environment and our days and our routines and build on this 30 minutes that you have that's in your policy now for all of your employees. Right? I think those are the hard questions that we need to start asking to move in that direction.
Thank you. I appreciate that very much. I'll kind of open it up for other questions if anyone in the audience has any that they'd like to ask of our panelists. Dr. Hudson, what would you like to ask?
I'm not sure. Yeah, here we go. Okay, sorry. I was wondering about medical education, and is medical education changing so that these aspects of healthcare and mental health care are being addressed in medical education? I mean, are young physicians, young medical students learning about the value of activity and on mental health, physical health? For any of the
anybody.
physicians that might have knowledge.
Well, I mean, I can say that, I did pediatrics and internal medicine, and pediatricians have been talking about social needs and social determinants of health for decades at this point, as well as, ACEs and other things. So it's certainly been in the training along the way. I think this specific recognition of the power of the outdoors and growth of evidence in other areas that may have in the past been considered fringe or, it's not a pill, so it's not worth talking about kind of problem we have started to come into the mix. When I returned from Silicon Valley back home to Oklahoma to join OU, I intentionally landed at the School of Community Medicine that was started in Tulsa because of its focus on the health of the community without bias towards we've got to do surgeries or give people medications. We do whatever we can to put sidewalks and build environment or anything else into the community. And that obviously is here as well in Oklahoma City. And so I really do think it's certainly in our curriculum, and it's growing to do that. We have a whole component called lifestyle medicine in what we're doing, but it could always be better. I do think information systems, and this is a big part of provider burnout in general, not just physicians, but the information systems we have are inadequate. They're built by engineers who are not clonicians, and they don't support these kinds of innovations without lots and lots of money and lots of time. And you've all heard the phrase "workflow kills everything else" for happiness in general. And the workflows are bad, and so we often just feel like we show up for work and we work for a machine all day, and at the end of that day we have some numbers that show up, and that's that. And we have to get out of those kinds of systems too. I guess that's my particular area of focus is there ought to be an easy way to make an engagement with the outside world happen. It ought to be right there in my system and easy to choose.
Okay, thank you. I think our schools need to be looking at that. By schools, I mean the universities and the medical schools. I mean, there needs to be a built-in component. Sounds like there may be. And, with each of our medical schools, our nursing schools, and probably workforce in general, because all of this gets back down to, what we do every day. It has to be easy. It has to be automatic. And I know that because I've been adjunct faculty at OCU College, the Kramer School of Nursing, that school systems are doing that, nursing programs are doing that. But it does have to be encouraged. I mean, when I didn't know that one physician, is it a day?
A day.
Dies by suicide?
About one a day.
that was staggering to me. I had no idea, and and I know that the rates for suicide and all that are going up, but that's incredible. I've heard about the dentist and that being an issue there, but I didn't know it was that with physicians. And so, I was one of those folks fortunate to. I grew up 18 years of my life across a dirt road from Ouachita National Forest. So our own property was very forested, and then we had that. And my brother and I would go and just spend all day. And looking at these photos, when you were showing the photos up here and it was showing a park setting or people walking, that just felt good to see that versus, then the girl that was stressed and all the pills and the prescription pad and the doctor working. I mean, that felt horrible. And so just that little clips of looking at that and then what, physicians are dealing with, I think the bigger point is we need to pull into this when we start a pilot and when we're reaching out to people. We need to make sure the upstream cause of this is to make sure it's built in for the physicians to want this for themselves and to want it for their clients. And I think, as an outsider, since I'm not an MD or a DO, I mean, that's something that just looks like to me that should be done and worked on.
Well, I can definitely talk about our clinic. We have students rotating through our clinic. We get students from OSU, OU, nurse practitioner programs, and PA programs. And we make it a point that when they come to our clinic, they participate in the programs that our department runs. We have a department in our clinic called as the Health Promotion Disease Prevention. Stands for HPDP. And we do after-school programs for our kids. We do day camps. We're very fortunate to have amazing community partners where our patients get to, like, we have a summer camp that's coming up at River Sports where they do kayaking, and it's free for them. And so we make sure that our students rotate through those programs to emphasize on the importance of, it's not just prescribing amoxicillin every day. It's about, addressing these health outcomes that are heavily dependent on your physical activity and diet. So we have made sure that that is a part of their rotation. We don't get them for a long time, but the little time that we get with them, we make sure we provide that for them. And also showing what we do for our employees, that counts. One of the things that keeps coming back to my mind when I was hearing Dr. Zarr's talk is having that plants in the office. That's one thing we lack in our setting. And I think that would be good to kind of promote as well.
May I just say a word or two? When I think back to when I was in med school, it was a while ago because I had more hair, and I remember when there was a move. This is at Baylor College of Medicine in Houston. So just to give you a little context. And, I remember when, there was a requirement to cover some public health, just a little bit of public health. And it was maybe a paragraph about p-value and confidence interval, right? And there's only so much room in there. And then I went to public health, got my master's, and I was like, oh my goodness, okay, that's really a small glimpse. Right? So, I mean, there's a lot to cover in med school. I don't know about you guys, but I was studying like 16 hours a day. I mean, the syllabus is this big, and that's back when it was paper. If you go into med school now, there's a computer open. I'm like, what is that about? But my point is that even though it is important, and I have seen examples of this in certain schools, like Harvard, for example. One of the faculty there is in internal medicine, and she is also a certified nature and forest therapy guide like myself. And she's been working really heavily on this. So if you do want to talk to somebody more about this and who's working intensively on it, I can certainly connect you. But I agree that it's not taken off like wildfire. And probably it's going to always take somewhat of the back seat because there's just so much else to learn as well. But having said that, I think there are other opportunities. For example, in order for us to keep our license every year or 2 years, we have to submit, proof of our continuing medical education, right? And we know now that there have been efforts in certain states that say, okay, if you are required 50 hours, of that 50 hours, one has to be on HIV, one has to be on laboratory medicine, one has to be on LGBTQ, whatever it is. And, that could be a way, possibly, just to plant a seed, pardon the metaphor, here in Oklahoma. Maybe there's somebody on the state, Board of Medicine to plant that, requirement, 1 hour of CME on nature and health. We actually put one to PRA, my organization, put a CM, was accredited APHA, American Public Health Association, certified 1 hour CME activity. We can always get that, if it's something you want to do, let me know. We can get it reaccredited and ready to go. But for example, that would be a way also to require every licensed physician to constantly rotate through this and always learn at least 1 hour of it. That's one thing you can do. And the other thing I might suggest is going back to the experiences, right? The indoor plants, which you said, I think you do want now, Dr. which is wonderful, but like providing these, nature-filled experiences for the physicians, for the health professionals, and their families on the weekends, things like that, connecting with the parks, giving them that exposure, experiential, personal. It's sort of like taking a legislator in D.C. or a state capitol here, and taking them on a walk, and showing them real time, in person, with nature, what it feels like. And it imparts a level of importance and urgency that you can't get from a lecture. So those are other things you could do.
They're bringing out the hook and they're saying, okay, we're all Thank you all so much. I thoroughly enjoyed our opportunity together today.
Well, we've ended our presentation, and I hope you enjoyed it as much as all of us did. Thank you for coming. I was looking to see if we might have another slide. There we go. Again, we are the Oklahoma City Parks and Trails Foundation, Greater Oklahoma City Parks and Trails Foundation. We always appreciate your support in helping events just like this happen and bringing incredible people to our city, and hopefully they move here. Thank you again.